Surgery Center, Viera, and we are going to be performing the Deuk laser disc repair on a patient who has herniated discs at L4-5 and L5-S1. He's got pain in both legs, worse on the left side, correct? All right. Now, what am I seeing there? I feel like we're off on orbit. We're using our x-ray machine to navigate. Let's just, well, so if you look at the iliac bones, you're lined up. But if you look at the sacral bones, you're a little bit off. Actually, it's not that bad. It may be 1 degree on orbit. I think we may be 1 degree on orbit. Let's see. So right now what I'm doing there, that's better. I'm talking to my team. Do you think it's better? I think it's better. Let's leave it there. We're trying to line up the patient's spine, which is inside his body, and we can't really control the movement of that thing. It's just there, the way he's laying on the table. That's set and fixed in its position, but we can alter the x-ray machine on the outside to get a nice, perfect view. And that's what we're trying to do. Are you comfy? Okay, good. All right, so at this point, we're close to where we need to be. I got just another inch or two to go. It's looking pretty good. Shot. Mm-hmm. Any pain? Shot.
You have pain in your back or your
AP.
legs?
All right. So our patient is a big guy. He's got a lot of soft tissue, like me. And patients with a lot of soft tissue, the imaging, the x-ray machine has a little bit harder time getting in there. But look, looks perfect. All right, I'm happy with where we're going. Everything's good, so just lay still and we'll be done soon, okay? Now our patients watched. How many Deuk laser disc repair surgeries have you watched?
5 or 6.
5 or 6. Were they all lumbar? Shot? He's having lumbar done, so that's probably why he watched lumbar. I'm right on the sacrum. There we are. So we're in 5-1, which is perfect. You okay? Notice we're to the hilt, which is, that's the maximum ability of our spinal needle. Alrighty then. You're doing great. Hang in there. We're halfway done. We'll be able to put you to sleep soon, okay? What do you say?
Understood.
All right. So, how long have you had your back pain for? All right, let's give some numbing medicine. 20 years. 20 years of back pain. Yeah, that's just more numbing medicine. Come on, come on. "20 years of back pain. How long have you had your leg pain for, Sean?" What did he say?
How long? Since 2021.
2021. So back pain for 20 years, leg pain for 1 year.
Yeah.
Shot? All right. Which leg bothers you the most?
Left leg.
Left. All right, don't move. You're doing great. We're almost done. I like to interview my patients in the operating room. It's good because the people watching are probably shocked that you're awake, but that's how the surgery in the lower back is done. We need you awake to help me navigate to the right levels and the right discs and the right spots. Yes. Great job, Jordan. Jordan has truly become a master of X-ray technology. with these procedures.
I don't want it to look.
That's perfect positioning. You're doing great. We're almost done getting everything into place, and then we're going to put you to sleep in a little bit. And then Dr. Berndes gets to have some fun managing your airway, right? All right. Not yet. Shot. You comfy? Is there any pain? Where? What do you say? Right hand side? Where on the right hand side? Your back or down your leg? Okay, that, huh?
He was saying left.
I don't think you said left. I think you
Sir,
said
were you
back.
saying left or right? Right.
Yeah. Where? Huh?
Right
Yeah.
hand side?
All right, well, just relax, take a deep breath. I'm done torturing you for the moment, but you are a smart man and you've watched my surgery, so you know what's next. I'll be gentle with you. So folks, what's going on? This gentleman has bones just like you and I do in our spines, and between his bones, which his bones are fine, he's got cushions, and the cushions are called discs. They're soft, almost rubbery. The bottom disc is the L5-S1 disc, all right, and it's literally between the S1 bone, the sacrum, and then the L5 bone, which is here, and then he has another disc a little further up between the number 4 bone and the L5, which is the L4-5 disc, okay? Now on the left side he has a tear on the L5-S1 disc, right there in the wall. And that's allowed the jelly to push out into the tear. The jelly normally lives in the middle of the disc, and it's sitting in the tear causing pain. And at L4-5, there's another tear on the right side, and there's jelly sitting in that tear causing pain. Now that's what causes his back pain. But it also gets on the nerve roots and causes leg pain. Are you comfy? I didn't do anything. How bad is that on a scale of 1 to 10? 10?
Yep.
All right. I apologize. So at L5-S1, is that where you typically get your back pain? I just need to know, yes or no, do you get pain in that area?
He said yes.
All right, so he had 10 out of 10 pain, concordant. I got great news for you. We're almost done. How bad is that on a scale of 1 to 10? Huh? How hot? 10? Is that where you typically get back pain? I got great news for you, my friend. When you wake up, that pain will be gone forever. You won't get it anymore. You're going to live a whole new life. You get to go to sleep. Can you count from 1 to 100 in Russian, please? Now I get to find out who the spies are. Right? Count out loud for us. I'm just kidding. You don't have to count in Russian. How about Korean? All right, so our patient is, what's that? Our patient's going to go to sleep now. We're going to get started on his surgery. We'll wait till you're asleep. Don't worry. Sweet dreams, nighty night. I need a knife. Is he counting in English or Korean or Russian? All right. We've already numbed this part of his skin up, so he's doing good. This is a surgery done through a 7mm incision. 7mm is not a lot of space to do a surgery. As a matter of fact, it's the smallest incision in all of spine surgery. I need you to get that wire out of the way so I can see the front of the spine. Shot? All right, the reason why we're not seeing the discs fill with dye is we're not putting the dye in the disc today. For those of you who have been following us throughout the day, you may know that there's a national shortage of contrast dye used in procedures. So the truth is I can do this procedure without the contrast dye, and as much as I like having the contrast dye to help me, during the discogram. It's not 100% necessary for the success of the procedure in these cases. So to save the dye for other people that need it more, we've decided to hold back on using it. But we are using our blue dye, our Deuk Spine alien dye. The dye we use, of course, when you wake up you become an alien because we've injected you with blue dye. I'm sure there's people out there that will believe what I'm saying. All right, here's my magic wand, right? Harry Potter has a wand, I have a wand. This is my magic wand. Actually, my laser fiber is probably more my magic wand, right? Yeah. But this is called a dilator, and this is going to slide down the guide wire, and it's going to open up things just enough to get this tube in there. And no, not that, but thank you. You're right, that's what I need to push this in. But this tube right here is what we do the whole surgery through. And I can tell you right now, it's going to be used to the maximum. Right, Luis?
Yes, sir.
All right, so how is he, doctor? We good to go? Is that a new blood pressure, or?
Yeah, just keep.
I don't want it going any higher than that. All right, so all right, everything's okay. So I'm bringing the dilator down along the guide wire. Now I can do that, and I will use the word impunity. I can do it with impunity. And what impunity really means is that I can do it without worrying. And the reason I can do it without worrying or caring is because I know that that's going to go in the right place as long as it follows this guide wire, which it has no other place to go. Let me have a little more numbing medicine. I'm going to give him a little more numbing local to make him a little more comfortable. All right, hopefully that will make him a little more comfortable. We're right at the fascia of the muscle. That's where the white covering of the muscle is, and it has painful nerve fibers in it. So if you have an issue with your fascia, it will actually hurt. You can feel it. A lot of the human body doesn't have pain fibers. What's wrong?
Oh, no, I thought you can push it more.
Yeah, yeah. No, I was gonna
Oh, okay.
tap it in, but yeah, that seems to be working better.
Okay.
All right. Now here I can't use the local as much because I'm too close to the nerve root. I might be able to use a little bit.
Yeah.
Let's try a little bit more.
Yeah.
You're at 1/4%, right?
Yes, sir.
1/4%. Any questions from our audience so far watching?
No current questions.
All right, let's run a video showing them why do people with herniated discs, how do they have back pain? A lot of doctors don't know that herniated disc can cause back pain, but they can. They're the most common cause of back pain and neck pain. So why is that? What is it about a herniated disc that causes so much pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. We're just advancing the tube that we're doing this surgery through into the disc at L5-S1 on the left side. And if you've joined us late, we've already done the access of the discs through the foramen. We've got tears at L5-S1 disc on the left and a tear on the right L5-S1. We tested the disc and they're causing severe pain, 10 out of 10 for this patient. So by repairing his annular tears in the back of the disc, that's the Deuk laser disc repair, that's what we do with this surgery. I expect that back pain to be gone from his discs. Also, we're going to be decompressing the nerve roots because he has pinched nerves on each side as well. Scope. All right, so for those of you who've never seen the surgery done, 7mm incision, and we're going to bring our endoscope in now. The endoscope is basically a long tube with lenses that allow me to see inside the disc. What I can see is right at the end of the scope here. So we're going to introduce this through the tube, and it's going to end up inside that disc, specifically in the herniation. All right, any questions from our audience?
No current questions.
Let's show our audience what the Deuk laser disc repair procedure is all about. What does the laser actually do? How does it help people get out of back pain? You got to learn that, okay? You got to look at.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back, and I hope you've enjoyed our animation. That was created by who we call the Trader Zach. The Trader Zach. Have you heard of Trader Joe's? Anybody go to Trader Joe's?
I love Trader Joe's.
Everyone loves Trader Joe's. Well, we hate Trader Zach. He's a different kind of trader. He's not a trader, he's a trador. Spelled Traitor. See, I got to make these surgeries somewhat interesting for those of you that watch them all the time. I've got to interject some interesting material about what's happening at Deuk Spine or what's happened at Deuk Spine. And I'm one of those old-fashioned people that value loyalty and people that are traitors, people that basically do bad things to our company. Well, they deserve to be called out, in my opinion. Now, calling out a traitor is not so bad. In the old days, they used to take traitors and they would hang them, or they would put them in a stockade. Anybody know what a stockade is? No? All right. Anybody see the movie A Knight's Tale?
Yes.
With Heath Ledger?
Yes, sir.
All right. Remember when the soldiers caught them and they put them in stockades where they had their arms and heads and bound in like a wooden thing with little holes. Yeah.
Laying down? Yep.
Yeah, they were standing.
Yep.
It's very uncomfortable.
Very.
I've never been in a stockade. I'm not that old, but but basically what I'm saying is it's okay to call people out for bad deeds because we're not doing, stockades or tarring and feathering or some of the crazy stuff they used to do in the old Middle Ages and medieval times. Though, believe me, I've thought about it. And if I could do it, I would. Just some of these people, right? Crystal's cracking up because she knows me. She's known me long enough. No, you won't get tarred and feathered, don't worry.
No stockade for you.
I mean, you guys have heard of the Iron Bull, right?
Yes.
The Iron Bull is a good one. I don't know. These are the things I remember from high school history. You don't remember a lot from high school history, but I tend to remember the tortures that were done to people. They were just so gruesome.
Back then there was a lot of ways to,
Drawn and quartering.
oh yeah.
Yeah. But the Iron Bull was one of the worst. All right, so for those of you wondering what's happening here, you're seeing a view at the end there, that bluish thing. That is the herniation and the annular tear. And the metal tube that's moving side to side and wiggling, that is the tube that's sitting inside the tear and the herniation. You see the blue line right there at 12 o'clock? I'll touch it with the laser. That is the annular tear. That's where all of his pain is coming from, his back pain. And this is the herniation right here, wiggling around that I'm blasting with the laser, trying to get rid of it. Any questions?
No current questions.
All right. Well, I really like this patient a lot. He's a good man, and I'm sorry I have to do this, but because there's no questions, I'm going to have to talk about what we've been talking about a little bit, just to add some color to this surgery. So let's find out what everybody's favorite torture is from the medieval times. We're going to find out who the torture experts are. Let's go around the room. Dr. Berndes, your favorite method of torturing from the medieval times? Tar and feather. So do you all know what happens in tarring and feathering? Let's hear it. Dr. Let's hear it. Dr. Berndes, tell us what happens in tarring and feathering. I'll relay it to our audience. This is what you get, by the way, for not asking questions. Yep. Yes.
And then, I think the feathering was more of a joke or to make light or make fun of whatever their behavior was.
Yeah.
Right?
That's right. So Dr. Berndes' favorite torture technique from the medieval ages was tarring and feathering, where the person was coated in black tar or pitch, and feathers were basically, they were covered in feathers as more of, hey, look, there's a black bird over there. That said, it took a long time for that tar to come off, and I'm sure it burned their skin. So it was a lesson they would learn, and it's not really fatal, but of course the smell too. I'm sure my wife wouldn't let me in the house if I had smelled a pitch. All right, next, Sarah.
I'm going to pass, being that I don't have a favorite torture method.
Sarah is going to pass, no problem. Oh, who has one? Other Sarah. Yeah, stay away from the fluoro.
Okay, so I saw one time where it's like this triangle, okay, and then they sit them on it, like saddling, like straddling it,
Ooh, ouch.
and then they pull their legs down so it like goes,
Woo!
yeah, it splits them in half.
That's hurting my
Oh, yeah.
my perineal region.
Yeah.
She's saying that there was a triangle that they would take somebody who was being tortured and basically take their clothing off and have them sit on top of the apex of the triangle and then pull them down onto the apex. That's a pretty good one.
That's the one that they take their arms open, legs open.
Wait a second, don't jump ahead now. Oscar's getting a little excited. All right, that's a good one. All right, Oscar, since you chomping at the bit here, what do you got?
This is the one that they have like a piece of wood, and they
Piece
put
of
the
wood.
person's head laying
Uh-huh.
down
Yeah.
to the side,
Uh-huh.
and they just cut it with a big axe.
Cut their head?
Yeah,
But that's going to kill them.
that's the most penalty, the maximum penalty.
Oh, okay, okay. All right, so basically cutting their head.
Yep.
All right, cutting the head with an axe and a piece of wood. That's Oscar's. Luis? Huh? You better figure out which one is your favorite. Luis, I don't hear you. What did you say?
Yeah. This one, they put a rat inside, probably like a
Ooh. Damn.
bucket, and then they hit the buckets, and then the rats try to escape on your abdomen or something like that. So.
Oh, I saw that in a movie. Yeah.
All right, wait, one more time. So there's rats in a bucket
Yeah, they put a rat on top of your abdomen.
on top of your abdomen.
Yeah.
Oh, and they cover it with a bucket.
Yeah.
Ice bucket.
So the rat basically just eats your abdomen.
Yes.
That's
so
bad.
They try to escape because they hit the bucket.
Oh my God.
And
Oh, so I've never seen this one or heard of it, but apparently Luis remembers a torturing where you put the person down on the ground, supine, where they're laying on their back, naked belly, and then they put a rat in a bucket, and they put the bucket upside down to keep the rats contained on your belly, and then they start hitting the bucket, so the rats get scared and they want to leave, so they start tearing everything up. Yeah, that's an interesting one. That's kind of bad. Yeah. All right, I like it. Crystal, I know you've got one.
So I like one that's like a witch thing.
A witch thing. So to torture witches, right? Just for witches.
That people, everyone thinks like witches were burned at the stake, but not really. They were pressed alive.
Pressed alive. Ooh, like grapes, making wine. Okay.
Actually, one of my friends, great
One of her friends were a witch? Oh, oh.
great grandpa or whatever was on trial for a witch,
Push it towards me.
and she got pressed alive. And the last words he said were more weight, and then they pushed a big rock on him.
All right, you did a really good job. So Crystal's favorite torture method is a press, a giant press that squeezes people and crushes them. And you're saying your friend's family member was crushed. And
Savage.
I'll just say as a side note, Crystal is enjoying that. Redheads. I see.
Oh, okay.
Yes. I thought all redheads were witches, no? Push towards me. All right, so Crystal's favorite torture method is pressing, squeezing, kind of like making wine out of a human.
What do you think would be the worst one?
Me personally, I think it's the what? No, it's the iron bowl. Oh God, they put you in a giant steel bowl, a bowl made out of steel that's hollow. They put a person in there and then they light a fire underneath it and they slowly cook. It's horrible. And of course, as the person cooks, they scream and it sounds like the bull is, I think they call it a wailing bull or a screaming bull or something like that.
It's like a lobster.
It's terrible.
Like a lobster.
Terrible. But it's interesting, you know, because as barbaric as these treatments were, I mean, they were all designed to do what? Teach a lesson. That's exactly right. Change behavior. Not of the person necessarily being killed, but of the people watching. And boy, people were really well behaved back then for the most part. All right. Jordan. Oh, Jordan, I'm so sorry. I forgot you, Jordan. I'm afraid to hear Jordan.
He was
Right?
scared in the back. He was quiet.
Oh, yeah. Jordan, do you want to share your favorite torture mechanism?
He is lethal.
You gotta speak louder.
5 to 7 would be thumb screws.
Thumb screws. Tell us about thumb screws.
It's essentially a wooden clamp,
Yeah?
and they put them around the fingers, and they get tightening and tightening.
Oh, thumb screws. So a wooden clamp, they put around your fingers, and then they would just tighten and tighten and tighten them until you succumb. And
Wrong answer, neither, neither.
yeah, I get it. The wrong answer. I love it. That's all it takes. You know, there were the Chinese torture, the bamboo underneath your fingernails. But those were used, actually it was the Vietnamese, I think, that did that during the Vietnam War for prisoners. Yeah, underneath people's nails. You didn't know that? Oh yeah. It's horrible.
There was one that they hang the person and then they stretch both arms, both legs,
Yeah.
until they rip apart.
That's the drawn and quartering.
Okay.
They tie your arms to a horse and
Yeah.
legs to another horse, and then they whip the horses until they go the
Stretch.
opposite direction. Yeah. Yep. Well, you remember the book, The Scarlet Letter. You know, when people don't ask questions, it's not my fault we go off on tangents. I can't be held responsible.
We literally just got a question.
The audience is like, enough. Gosh, please stop. All right. Yes.
And this question comes from Ethan on YouTube.
Hello, Ethan, on YouTube.
And he asked, can Dr. Deuk explain how a disc can re-herniate if it has been removed and a cage installed?
Great question, Ethan. So Ethan's asking a very good question. And he's not talking about the Deuk laser disc repair, obviously. He's talking about a patient that goes and gets a anterior cervical discectomy and fusion, or a lumbar fusion, where the surgeon takes the disc out and puts a cage in there to fuse it. So he wants to know, if that's done, how does the patient go on to have another herniation at the same disc? How is that possible if the surgeon took the disc out? The answer, Ethan, is the surgeon, yes, they tell you they're going to take the whole disc out, but they don't take the whole disc out. It's not possible to get 100% of the disc, no matter what surgery you do. So there's always something called residual disc material, and there's a herniation piece, and that's what's re-herniated, is that leftover disc material that was, on the side of the cage or behind the cage. But honestly, it should never cause symptoms if the surgery is done right. The problem is when the surgeon doesn't do the surgery properly, then the patient gets symptoms from a residual disc herniation. And what? You're fine. And I've seen that happen before. Unfortunately, there's a lot of that. It's basically, Ethan, the simplest way to say it is the surgeon didn't do the surgery very well. They were sloppy. They left herniated disc there, and they left disc material there, and then they didn't get it all out. Okay? Unfortunately, the truth is, not all spine surgeons are created equal. Huh?
5 minutes here?
On this disc? 1 minute. 1 minute left. Almost done. I've got most of the herniation. I'm just trying to clean up the rest of the tear. Good job, Oscar,
Thank you, sir.
on helping me with the fiber. I tell you, Luis introduced me to this bigger fiber. Push a little bit. Try to get me to 12. Yeah. Bring your hand that way. That way. There you go. And there you go. What do you think, Luis? That's the best way to do it?
Yep.
So we used to use a fiber. This fiber was smaller, and it was half the size. And Luis found the bigger fiber, which actually works better. And that's why we use it now. All right, just about done here. That's fine. We're not done. We're almost done with one disc. We still have the other one to do.
Okay, my friend, stay still.
Any other questions?
You're doing great.
No current questions.
Just relax.
Doing great. Don't move.
We're all here with you.
Just about done. 10 seconds.
50% do the surgery.
Yeah.
75%, we're just gonna do one more. This.
Luis, did we get the scope back? The one that was repaired?
No back, no back. They are,
All right. Laser out? Huh?
fixing this week probably.
But everything's okay?
Fixing today or tomorrow probably.
All right, let me see. Do I want to get any of that? I think I do. Scope, laser? Just going to put the laser on one more time for 10 seconds and we should be done. With this disc. This is L5-S1. We haven't done L4-5 yet. So this is kind of lateral. Look how scarred up it is. And the way the laser works, in case you're wondering, it literally vaporizes the tissue. It delivers invisible energy, which is laser spectrum energy. It's part of the electromagnetic spectrum of energy, so it's a waveform of energy. And it's very powerful, and that's it. We're done. And it's scope off, please. Let me have the betadine first. Oh, right. Yeah.
But that has a little bit of ankle there.
Oh, that's fine. Good job, Luis. Okay. We are pretty much done here with L5-S1. I'm going to show you in just a moment this tube. Can you guys see this over here?
Yep.
So the whole surgery at 5-1 was done through a little tube. No bone was removed from his spine. No ligaments or joints were removed or damaged. The muscles weren't damaged. Nothing was damaged at all except for the skin. We made a 7mm cut. That's the only damage we're doing. And we actually entered the disc herniation right in the herniation. So the herniation is on the outside of the disc in the back, right where the natural hole is, called the neuroforamen. And we're entering the disc through the herniation and the annular tear. That's the beauty of the Deuk laser disc repair and any transforaminal disc surgery, is you're actually not damaging the disc further with the procedure. Okay. I'm going to switch to the other side of the patient's right side, so I can do the L4-5. So remember, we're fixing 2 discs today. A lot of surgeons will only fix 1 disc at a time. And that's a problem for the patient, because that means they're going to come back and have another surgery. Who wants to come and have a second surgery? I don't. Shot? The problem with having more than 1 spine surgery is every time you go to surgery, you run the risk of complications. So the more surgeries you have, the more risk of complication you have. So it's always better to get everything done in one surgery, 1 treatment if you can. That's the way we do it at Deuk Spine Institute. Not many spine surgeons do that, though. They all want to have the patients come back, have multiple surgeries, because honestly, for them it's easier. Shot? You're doing great. Just relax.
I'm great, my friend.
We're almost done. All right, let me know when I can proceed. You want a minute?
Yeah.
All right, let's just do a little more local too.
Yeah. Sleep apnea, best treatment.
Shot? No problem. I'll see what I can do for you.
Thank you.
The problem is these things are not very pain sensitive. So fixing them doesn't really fix the biggest problem, which is the disc. And I don't want to use it down by the
I
disc.
understand, yeah, I understand.
But, I mean, at some point,
Sometimes driving in that cannula and going through,
huh?
sometimes driving that cannula is really sensitive.
You mean through the tear?
Just you going through
You mean in the fascia? Yeah. Yeah, I went back and numbed the fascia up. So I just needed about a minute worth of. All right, why don't we run the video, by the way, of the comparison of the Deuk laser disc repair with other types of back surgery to treat back pain, like fusions.
Okay. We do have an extra question.
An extra question. We'll take that first then.
No worries. This comes from Julie from Facebook.
Julie. Hi, Julie.
And she asks, can Dr. Deuk tell me what causes a synovial cyst?
Yeah. Julie, thank you for asking. And the question is, what causes a synovial cyst? That's a great question. So I'm going to have Jordan show you the facet joints. That's where they come from. Go ahead and show the facet joint at the level above. Yes, right there. No, go to the left. There. That's the facet joint. So that's a type of joint in the back of the spine that is a synovial joint. We call it a diarthrodial joint, and it has a synovial membrane around it. So when you get arthritis in that joint, it creates a cyst. It can create a cyst that bulges out, and that cyst can then pinch on nerves. So synovial cysts do not come from the disc, they come from the facet joints. That looks good, huh? This is a huge tear, by the way. That tube went in so easily that you know that tear is huge. So I barely had to tap it. And that tear is where his pain is coming from. All right, we're going to drop the table a little bit. Make it a little easier for me to do my job. Great question. Let's go with the comparison video, unless you have another question from our audience.
Nope.
That's fine. All this.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Welcome back after that video comparing the Deuk laser disc repair to a spinal fusion for lower back pain. Fusions do work as long as you get all the discs that are causing pain. If the patient has 3 discs causing back pain, you need to fuse all 3. And if they have 2, you need to fuse 2, so on and so forth. What I found over the years is that most people have 2.5 discs on average that cause pain. So most spine surgeons only fuse 1 disc at a time. Then of course they're never going to get all your pain. So if they don't get all your pain, that means you're going to go out of the surgery with pain. I don't believe in just half treating things. It's not right to do that. By the way, right here is the old, look at all that old scar tissue and calcification. This is the old part of the herniation that started 20 years ago. Look how fibrous it is right there. Very fibrous, very calcified. We also had a lot of new herniation. All this blue stuff right here is all the new stuff. You can see that the old calcified stuff and scarred up stuff, the old stuff, it doesn't stain blue. It stays white, even with the blue stain. That's how you can tell the difference usually. All right, if you haven't downloaded the Deuk Spine Institute app, go to your app store and look up Deuk Spine Institute app. It's free, there's no charge, and there's a lot of good information in there for you and your friends or loved ones that have back pain or neck pain issues. We're just about done with this surgery, another 2 minutes or less, and I just want to give you all an opportunity to ask any other questions you might have. Again, I'm Dr. Deuk Majan. I'm the founder and CEO of Deuk Spine. I've got my A team with me today, and this is our last surgery for today. A little inflammatory tissue right there. See that? A little pink stuff. Pretty cool. So we're going to be wrapping things up in just a minute, but I want to give you all a chance to type up any other questions you have. I can come answer them for you face to face. Also, we broadcast surgery live every week. Our next surgery day is Thursday. We'll be back on Thursday with more surgery. If you know somebody with back or neck pain, have them send us their MRI. We do a free MRI review, and we can figure out what's wrong and give them advice. We can do it virtually as well, so they don't even have to come to Deuk Spine Institute. Once again, this patient had a lot of scar tissue here from many years of inflammation within their disc, and that inflammation is what's caused their back pain. So now that we're getting rid of the herniation stuck in the annular tear, called the interposed herniation, I expect their back pain to go away and their leg symptoms as well. All right, that should be it right there. Just 30 seconds. We should be done. This whole area that's cored out, you just don't see any more herniation. That's where all the pain was coming from this disc. So I'm very happy. We did a nice job. Let's see where the nerve is. The nerve should be right up here in the fat. Can't see it, that's fine. It's good that we can't see it. It means it's protected. I just want to say you all did a great job today. Thanks for your help. And our other 2 patients we already did surgery on are already gone home. One was from Ohio, one was from Mississippi. The first one was from Ohio, and the second one was from Mississippi. And his weakness in his arms is completely normal now. Gone. No more weakness. So already recovery of strength. Yeah. So this guy, this patient right here, you can see that's the last of the tear right there. And you can see that he really blew this thing out a long time ago medially, and then because the scar tissue was so dense over there medial, he then blew it out lateral. We're done. Type up your last questions you might have for me. I'll be happy to answer them for you. Scope off.
Please, thank you.
What's that? Hold on a second. Go ahead and type up questions. And why don't you run one of our testimonials for people, and then I'll be over there to answer questions.
No problem.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is... I'm Dr. R. Deuk here at the Deuk Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Deuk Spine Institute?
Dr. Deuk, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Deuk laser disc repair did. You can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser. And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery, but they are. And they're very, very powerful tools and very precise. So we were able to clean out your discs, remove the herniation. And how do you feel today?
I feel great. I mean, it's probably, I know I'm on camera right here, but I literally could not walk into the office yesterday. And you're gonna see my shorts and everything, you'll have to edit, whatever, but I'm able to walk.
That's awesome.
It wasn't even close. I was actually, and I don't know if you can tell from the camera what my personality is, but I try to be very polite, and I was apologizing for profusely sweating because I hurt so bad. It's not because of the Florida heat by any means. It's because I hurt so bad. I'd never experienced pain like that. And like I said, there's no respite.
You're a redneck too. You're not that far from Florida.
That's
you're
right.
Just up a state or two, right?
That's right. Yeah.
A couple of states. So you're feeling better today. It's been less than 24 hours since we did your surgery. You went home an hour after the surgery, back to your hotel with your lovely family who I met. And how do they feel about your progress?
They're happy that I'm happy. You know what I mean? Because they were scared too. Now they were putting on a strong front, but I am just telling you, I was at my wit's end. And I certainly are a lot more appreciative of people who have pain that I'm aware of, because when there's no rest from it, oh my gosh, you know what I mean? I was really at my wit's end, and you saved me. So I appreciate you very much.
You are welcome, sir.
Yeah.
Is there anything else you want to say to your fans out there?
Thank you. Sorry, I could have pretty you up for you a little bit better. So just had surgery yesterday.
All right.
Cut me some slack.
Excellent. And you're heading back home today, correct?
Yeah, right, going back on the plane later this evening. The kids are going to swim a little bit down here in Melbourne. I am just going to rest and watch TV, but then we're going to get on a plane a little bit.
Awesome.
Yeah.
All right. Well, congratulations. You had faith.
Yes.
Took the
I have
leap
faith.
and you got the surgery done.
Yes, sir.
All right. Awesome.